Cocaine is the topic for this video, and cocaine is an illegal drug with very high abuse potential. It comes from the leaves of a coca plant, and it can be used either IV, it can be smoked, used intranasally or orally. Wanted to talk a little bit about pathophysiology. Cocaine enhances the activity of 3 neurotransmitters, and those are norepinephrine, dopamine, and serotonin. And each of these has a very specific effect on the body once its activity is enhanced. For example, norepinephrine activity being increased can lead to tachycardia, increased heart rate, high blood pressure, hypertension, diaphoresis, excessive sweating, hyperthermia, feeling very warm, and mydriasis, a dilated pupil. Dopamine activity being increased can lead to the abuse and dependence that cocaine users can develop. A very important effect of cocaine is vasoconstriction, and this can lead to a lot of problems. The first, of course, is when you vasoconstrict the blood vessels, the pressure will increase, and that will cause hypertension, and oftentimes this can be severe. Another thing, vasoconstriction can cause problems related to ischemia, where certain parts of the body are not receiving the blood supply that they are supposed to because the blood vessels are now vasoconstricted. Ischemia can lead to all kinds of problems. One of the most common is a myocardial infarction, MI. One more thing I wanted to mention in pregnancy is a rather serious condition called placenta abruption, and that's essentially when the placenta separates from the uterus. So keep these in mind. These are some of the more highly tested effects of cocaine on the body. So now let's get into the symptoms. Initially, a patient will experience feelings of euphoria, which is increased happiness. They will have increased energy. The patient will also be more alert. So that's part of the reason why people do cocaine, because the initial effects are desirable to the individual. But unfortunately, with illicit drugs, there's a long list of undesirable effects that can happen with toxicity or overdose. Toxicity or overdose can lead to panic attacks, agitation, aggression, hallucinations, seeing things or hearing things, seizures, and as we discussed before, an increase in blood pressure, and a long list of other undesirable and fatal consequences. For example, myocardial infarction, which can of course be fatal. Another common way that a person who has a cocaine overdose can die is a cardiac arrhythmia. One more important aspect of the symptomatology is what can happen to somebody who is suffering from cocaine withdrawal. This is different from the acute effect or the toxic or overdose effect. This is basically a post-intoxication depression or crash. So after the patient uses, what happens later on when the patient is withdrawing from cocaine? Symptoms include depression, suicidal behavior, difficulty concentrating, increase in appetite, and increase in somnolence. meaning the patient is more sleepy or drowsy. So be able to identify withdrawal symptoms on a clinical vignette. A diagnosis of a person using cocaine, of course, is done with a urine drug screen. The metabolite will show up. And if the patient presents with chest pain, because cocaine use can cause cardiac problems, the patient should have a cardiac evaluation, such as an EKG, cardiac enzymes. In terms of treatment, initially you will give benzodiazepines, IV, to help with the agitation and seizures. For example, a commonly used benzodiazepine is lorazepam. And to treat the high blood pressure, which is often a presenting symptom or physical exam finding, you would use nitrates. For example, nitroprusside. So let's take a look at a couple vignettes, see what this looks like. The mother of a 35-year-old man calls her primary care physician for advice on drug treatment program for her son. She states that he lives with her since the loss of his job and apartment 4 months ago. She reports that he goes out on weekends and uses drugs heavily. When he returns home on Monday mornings, he sleeps for the entire day and seems very depressed. He is also very irritable and anxious over the course of the next day. She knows of no other withdrawal symptoms. She believes that he uses the drug throughout the week, but with more intense binges on the weekends. On several occasions, he has called her from the local psychiatric emergency center after admitting himself for suicidal ideation after use of the drug. Which of the following drugs is most likely responsible for this man's withdrawal state? The question is already telling you that he is suffering from some form of withdrawal. Now, which drug is that? The stem of the question describes depression. It describes suicidal ideation. It also describes the patient sleeps the entire day, which is somnolence. And all of those things point heavily to cocaine withdrawal. 39-year-old businessman with no prior medical problems is rushed to the emergency department following the sudden onset of dizziness, shortness of breath, and palpitations. His blood pressure on admission is 190/110 and pulse is 124. He is diaphoretic. His wife says that his behavior has changed over the past couple months since he became CEO of his company. He has become moody. At times he seems energetic, euphoric, or irritable. Then he seems to be down for no reason. He just returned from one of his many business meetings and again spent more money than ever before. The patient is smiling inappropriately and denies any alcohol or drug abuse. Which of the following will most likely be found on a urine drug screen? Several telltale signs, for example, sky-high blood pressure in a patient that's relatively young with no prior medical problems. Why does he have such a high blood pressure? Diaphoretic. Those are all the symptoms of cocaine toxicity or overdose. And then the fact that he's spending a lot of money. Cocaine is indeed very expensive. And then the wife describes that sometimes he's energetic and euphoric. That's basically what's happening when he's taking cocaine acutely. The acute effects of cocaine are causing him to be happy and energetic. And then later, when the effects wear off, he seems to be down. So all this points to cocaine being found on his urine drug screen.